Okay, good day everyone. Welcome to our video channel again. This is a channel where we teach practical procedure in manual therapy and acupuncture. And by the way, I'm Professor Gani Shokunbi from Physiotherapy Department, Bayo University, Kano in Nigeria. Today, what have we got to show today? Today, we want to demonstrate how we can use acupuncture to facilitate stroke recovery. To so many people, acupuncture is just for pain or for one of those two things in the musculoskeletal area. But acupuncture, scalp acupuncture, is really one of the recent techniques that people that practice acupuncture can use to facilitate recovery in stroke. Now, for scalp acupuncture, you're going to need something like methylated spirit, something to clean your hand before you even touch the needle. If you are using methylated spirit, you need to scrub every area of your hand for at least 30 seconds. Then we're going to need acupuncture needle. About 75 millimeter type of acupuncture needle should be sufficient for scalp acupuncture. Then you might need some cotton wool or some piece of tissue paper just in case there is a bleeding. Normally, if the needle did not go through the blood vessel, there will be no amount of bleeding. All right, please come with me. The next thing we would like to point out are the landmark that will be required for scalp acupuncture. Now, before we go into the needle proper, the first landmark that we have to take note of is the mid-line anterior-posterior line that runs from the middle of the eyebrow to the occiput. That's the first landmark. The second landmark we're going to need is what is called the eyebrow occiput line. And that's the line that runs from the eyebrow to the occiput. The third landmark we're going to think about is the anterior temporal hairline, the pathway through which the hairline follows. Okay? Now, scalp acupuncture is based on the premise of homunculus, that is, the different parts of our body being represented on the skull. And we can actually stimulate those areas of the skull for disorder caused by those areas in different parts of the body. The upper limb is represented there, the lower limb is represented, the face is represented. So by stimulating this area of the skull, those parts of upper limb, lower limb, and face will eventually go into recovery following stroke. Okay, so after that, I've already explained the procedure to my patient. I've gotten my patient. In order for us to get recovery of motor function in stroke, we need to put the needles in the motor area. Now, how do we get the motor area? You remember the anterior midline. You follow that anterior midline to the center, and then you measure 0.5 centimeter posterior to the midpoint, and you insert the first needle. So this is the highest point of the motor area. Now, the lowest point of the motor area is a point where the eyebrow occiput line meets the anterior temporal hairline. It's like a little dimple in that area. Again, we can set the needle in that area. The procedure is quite safe. A lot of people will be wondering, oh, is it going to put needles into my brain? No, it doesn't get to the brain at all. You have the skin, you have the superficial facial. After that, you have the aponeurosis. After the aponeurosis, you have the bone. You have the periosteum, you have the bone before you get to the brain. The needle normally stays in the subcutaneous fascia, or it just touches the aponeurosis a little bit. So it doesn't in any way get near the brain. So this is the motor area. So anywhere we stimulate along this line is going to lead to motor recovery. But what we're going to do specifically is to divide this line into 5 equal parts. So we have the upper 1, 5, followed by another 1, 5, another 1, 5, another 1, 5, and another 1, 5. Now, for motor recovery in the lower extremity, in the contralateral area, we know how the brain works. When you are stimulating the left side of the brain, the right side of the body is responding. When you are stimulating the right side of the brain, the left side of the body is responding. So we have identified the motor area. Imaginarily divide the area into 5. The upper 1-5 area, which is about this area, if I stimulate this needle continuously for 3 minutes, I will be working on recovery of function in the lower extremity of the affected part. So the upper 1.5 is useful for the recovery of contralateral lower limb. And then the middle 2.5, this is another 1.5, this is another 1.5. Anywhere between here and here, that's middle 2.5, could be used for recovery in the upper extremity. So if we go on to carry out this procedure, keep stimulating for another 2 to 3 minutes, we'll be working on recovery of the upper limb on the contralateral aspect of the body. And then for the face is the last 2.5. Any point you pick in the last 2.5 area, insert the needles, and you do this stimulation, will lead to recovery of the facial muscle of expression and speech disorders. So ideally, that's how the needle will go. For the stimulation to work, you need to work on each needle for at least 3 minutes. Then you rest for 5 minutes. Then you repeat the procedure 3 times. So that means in a standard treatment, I'm going to work on this needle, keep stimulating it for 3 minutes, rest for 5 minutes, and come back another 2 or 3 times to repeat the same thing. That's for the lower limb. The upper 1.5 is for the lower limb, the trunk, and the head. So the middle 2.5 is for the upper extremity, and the lower 2.5 is for the muscles of facial expression and speech disorders. If you try this for 6 weeks, you will obviously see the results on your stroke patient. Now, we have identified the motor area. What about the sensory area? Because stroke patients have a lot of problems, motor problems, sensory recovery problem, cognition problem, balance and coordination problem, which we're going to talk about in our subsequent video. But for sensory recovery, all you need to do is to measure 1.5 centimeter posterior to the upper motor point, 1.5 centimeter posterior to the lower motor point. So you have the line there. And it could also be divided the way we have divided the motor point. The upper 1.5 will be for sensory recovery in the lower limb, the head, and the trunk. The middle 2.5 will be for sensory recovery in the upper extremity, and the lower 2.5 will be for sensory recovery in the face, and something about the speech, the tongue, sensory recovery in those areas. So this is how scalp acupuncture for stroke recovery is carried out. Please don't forget to like this video and subscribe. And if you have any information, please, or any question, please pass it on to us. Thank you very much.